parliamentary practice. So I'll go straight into business. So I'll call on Lorraine Dempsey, interim CEO of Inclusion Ireland, to make her opening remarks. So Lorraine.
Thank you very much. Dear Deputies, Senators and Chairperson, Inclusion Ireland welcomes the opportunity to be here today. Since the beginning of the COVID-19 period in March 2020, we've seen many health and social care services, including disability day services, closed to people with intellectual disabilities. Thankfully, day supports have remained open during the second and third lockdowns, albeit on a limited basis for many and little or not at all for a few. Inclusion Ireland has previously addressed Oireachtas committees on the multiple suspensions of children's disability services and the lack of educational supports during school closures, which parents report had affected their children's development and many who were regressing. This cessation and the reopening of these services has had a significant negative impact on people's affecting their well-being, independence and the mental health of people with disabilities and their families. Prior to COVID, many people with an intellectual disability told us that they felt invisible and poorly treated by mental health services and that they were struggling to access them. And now, given the impact of the pandemic on the mental health of people with an intellectual disability, there's expected to be an increased need for mental health services as a result of COVID-19. It is vital that the Mental Health Intellectual Disability Programme is rolled out and funded and established in communities across the country. Over 3 years on from the ratification of the United Nations Convention in 2018, Ireland is at an important juncture where leadership must be shown by government in its implementation. The new Department of Children, Equality, Disability, Integration and Youth must show leadership and actively promote the implementation of the Convention across all government departments. One crucial element of the Convention's implementation is the ratification at the earliest opportunity of the optional protocol. Another important aspect of ratifying the Convention is the full commencement of the ADM, or Assisted Decision-Making Capacity Act 2015. As the Act was enacted several years ago, but it's yet to be fully commenced, we need to see action on swift commencement of the Decision Support Service and ensure that those being made ward of courts as a result of this Act not being fully commenced is redressed as soon as possible. Full commencement of the Act is essential to ensuring that individuals with disabilities have the support to exercise decision-making and choice in their own lives, and it also plays a key role in the state's compliance with the UN Convention. The government policy, Time to Move On from Congregated Settings, was clear in recommending that all congregated settings would be closed by 2018, and this simply hasn't happened. In total, 8,300 people currently live in residential services, with an additional 1,500 people with a disability under the age of 65 living in nursing homes. And according to HICWA, these figures include about 2,900 people living in congregated settings. And we know the consequences and risks of this arising from COVID-19 over the last year. The Convention is clear in its opposition to institutionalised living and on the rights of people with disabilities to live a life in the community. So it's imperative that the Irish state ceases the continued use of institutions that are in clear breach of domestic and international rights and increases funding to accelerate the deinstitutionalisation process. One of the biggest barriers facing people with an intellectual disability in accessing accessible social housing is the clear lack of available support services that are required for them to live in their own home. For people who need supports in their home, they have no clear pathway for applying for these supports. Through our advocacy work, we have found that many people report being highly placed on social housing waiting lists due to their disability, but then they cannot access this through their local authority due to the support services not being readily available at the right time, and this must be addressed. I'll now hand over to Jackie Brown, my colleague, who will speak on the work of the Disability Participation and Consultation Network. Thank you.
Thank you very much, Lorraine. So now I call on Jackie to give her presentation.
Thank you very much, Chair, and to Deputies and Senators. It's a pleasure to be here today, and to thank you for this opportunity to give an input at this sitting of the committee. My name is Jackie Brown. I am the chairperson of the DPO Coalition, and we are one of the member organisations of the Disability Participation Network, and I'm here today presenting this statement on behalf of the entire Disability Participation Network. This is a very young group, and I'll tell you a little bit more about it. So we see the development of the DPCN as a very important milestone for the disability community, and we welcome the commitment to it from government towards its establishment. The overall purpose of the DPCN is to ensure that disabled people and their representative organisations will be heard directly by government making decisions in relation to disability policy and law. There are 4 grant-funded members of the DPCN, as I am, is one of them. The coalition of the 6 national organisations of disabled people, of which I'm chair, and that's known as the GPO Coalition. The Disabilities Federation is the 3rd grant-funded member, and the 4th grant-funded member is the Mental Health Reform. So as you can see, it's a very broad church of a membership. The membership of the DPCN also, and very importantly, includes over 100 non-funded members, individuals and disability organisations. Representatives from the 4 grant-funded members, along with Inclusion Ireland as the network organiser, are involved in establishing the network. Our immediate task, however, has been the network's response to the state's draft report under the Convention on the Rights of Persons with Disabilities, and that consultation process closed very recently on April 9th. The DPCN held 6 consultations organised, which obviously included anyone and everyone from around the country. In these COVID times, everything was online, and there were over 190 people participating across all those 6 consultation sessions. This presented a very good opportunity for the DPCN to connect with the wider membership. And following the consultations, a response to the state's draft report was formally submitted on April 9th last. It's been a very challenging start for the network. It's new. We've only begun meeting. It was established in December 2020. We've, in reality, only began meeting since January, with the timeline of the 9th of April to be met for a submission. So the 5 organisations, we've been working together for the first time, and also at the same time consulting with over 100 members on the state's report. And all this has happened within such a very short time frame. Our next priority now is to explore how we can formally establish the network to focus on governance, organisational structures and planning for the future. However, given the substantial increase in the network's membership, many of whom are volunteer-led, additional resources are essential to ensure that our participation is genuine, active and meaningful, and that the voice and the direct voice of disabled people is prioritised at all times. Thank you very much.
Thank you very much.